COVID-19 lockdowns were a global policy failure of gigantic proportions. That's the central conclusion of a new landmark study published by the Institute of Economic Affairs, authored by academics from Johns Hopkins University and Lund University. Jonas Herby, Dr. Lars, Jonung, and Professor Steve Hanke find the draconian policy failed to significantly reduce deaths, but did impose substantial social, cultural, and economic costs. Their findings suggest that lockdowns reduced mortality by just 3.2% when compared to less strict lockdown policies, which were adopted by countries like Sweden. That means that 1,700 fewer deaths in England and Wales, which pales in comparison to Imperial College of London's March 2022 modelling, which predicted that lockdown would save 510,000 lives in the United Kingdom. This finding is based on a meta-analysis examined almost 20,000 studies on measures to protect populations from COVID. This is considered the gold standard for evidence, as it combines comparable, independent studies to determine overall trends. The research concludes that voluntary changes in behaviour, such as social distancing, played a significant role in mitigating the pandemic. Harsher restrictions, like stay-at-home rules and school closures, generated incredibly high costs, while producing only negligible health benefits. The authors conclude that the science of lockdowns is clear. The data are in. The deaths saved were a drop in the bucket compared to the staggering collateral costs imposed. To read the full paper, visit www.iea.org.uk.